Hey everyone, this is an instructional video on scar tissue massage. This scar tissue massage is to be used after 4 weeks post-op, once the scar has formed and once you can comfortably feel the scar and the scar tissue around it. Be really careful that if there's still bruising or a swelling and the scar is very active, that you probably don't want to do this massage until that's calmed down. So I generally get people to do scar tissue massage after 6 weeks post-op, even though you can do it after 4 weeks. What's probably more appropriate is to do the lymphatic tissue massage up to 6 weeks. After 6 weeks, you can start manipulating the scar tissue. So scar tissue massage is just that. It's manipulating scar tissue so that we can encourage more blood flow in the area, new blood flow to the area, and for the fibroblast activity. Fibroblasts are the cells that lay down the scar tissue matrix. So when the scar tissue matrix is laid down, it's laid down in a series of cross-tissue matrices. And this matrix is really, really strong, and it's meant to be very protective and even stronger than skin, which is a lot harder and longer to regenerate. So that's why we have scar tissue. What scar tissue can do, if it's organized in these grids, it can become quite tight. We can get adhesions. And basically what we want to encourage is really good, nice, linear scar tissue formation. And so we do this in 2 ways. One is we restore range of motion of the area as soon as possible. Again, I would not recommend that until 4 weeks post-op, especially for an area like the chest. Other areas like the face or hysterectomy or things like that, you don't have to worry too much about movement, depending on how you want your scars to look and depending on how well you want them to seal. You want to reduce the movement until about 4 weeks post-op. After that, you should be trying to move as much as you can and get your full range of motion back so that also we don't end up with adhesions to the actual chest wall. So what we want after a period of time is a scar that is in a linear fashion. Okay, it is not adhered at all to the chest wall. We want it to be completely floppy. We want it to be soft, non-tender. We don't want it to be tender at all. And although it's going to be uncomfortable to touch for a long time, potentially 2 years, we can get it to a point where it's quite easy to touch, normal sensation, no lumps and bumps, really smooth. Sometimes scars will produce their own hairs. Often scars have bigger pores than others, so they need this kind of interaction because the pores get big. If they get blocked, you can get infections and things like that. Nothing crazy, just uncomfortable. When it comes to the nipples, especially if you've had nipple grafts, more importantly if you've had nipple grafts, it's really important not to manipulate the nipples too hard or initially. So again, I would just leave the nipples, unless you feel like there is scar tissue underneath, leave the nipples alone. I, at the moment, have some blocky scar tissue underneath this nipple, and I can feel it when I move it around, but my nipple is completely sealed. It's been 2 years since I had surgery, and so me manipulating this area now, it can't cause any damage. 6 weeks post-op, the nipple grafts are still very sensitive, so you want to leave the nipples for a long time before you touch them or try to do any scar tissue massage. So, unlike lymphatic drainage, we don't need to do any pre-manipulation. We just want to go to the scars straight up. The type of pressure that we use is a little bit more than lymphatic. So in lymphatic, we just move the skin. With this one, we want to kind of like, rather than just manipulating the skin, we want to go a little bit deeper and like we're manipulating muscle. Okay, so you should be able to feel some deeper elements. You should be able to push the scar tissue up against something and start to move it around. It'll feel uncomfortable. It always does. Even as it gets more comfortable, it still feels uncomfortable to massage it. So that's the kind of massage pressure we want to use. We want to be able to go through the skin to the muscle or like through the scar to the lower scar tissue and move it around. The kind of movement we want to use is 2 different types. The first one is brushing along the scar, underneath the scar and above along the muscle. okay, the muscle fragments. The way the muscles move are organized, I should say. And we want to use stroking movements along, and we want to use circular movements. The circular movements are really great at releasing adhesions, okay? So what kind of oil do you want to use? You can use any oil with vitamin E in it if your body doesn't keloid. If you get keloids, it's probably better not to use vitamin E because it encourages scar tissue. If you have keloids, it's probably better not even to do too much of the scar tissue massage. More importantly for keloid is doing things like the flushing with the lymphatic, do more of that. Okay, so the things that I recommend that are really, really good for scar tissue massage if you don't have keloids is vitamin E capsules. So you can go to a chemist anywhere and you can buy vitamin E capsules that you would normally take internally. So this is a vitamin E capsule. It's quite large, and this is also a vitamin E capsule, which is a lot smaller. This is much more concentrated vitamin E, and this one isn't. It doesn't really matter because both of these are more concentrated than the oils that you can buy for the skin. So this is a much better option. What you do is you take the capsule and you pierce the top. I pierce the top with a pair of scissors, so you should just be able to cut some of that. You should be able to just cut some of that top off like this, okay? And it will free up the oil underneath. Okay, so the oil underneath, you just pop it onto your fingertips. Okay, and you can apply it. I usually just put it across. Okay, I put it across. I'm gonna be massaging up around the nipple and up into the muscle as well. So put it under your armpit and along the scar and just underneath it as well. I found that I had some adhesions or scar tissue in the middle here that needed to be released. Some of the fascia that comes in to insert itself into the sternum, and I released that, and it would release the scar down into this sling area. It was really good. Okay, so just lather that on. You can use 1 capsule per side. Make sure you've got plenty. You don't want to dry out. If you're if your scar tissues love the oil, it'll absorb it really fast, so just keep an eye on that. You might need to add more. You can use as much as you like. There's no limitations. So once you've got the massage oil onto your scars, I always start with the pecs, and I start in at the sternum, which is where they attach, and I, in a flushing movement, go across to the shoulder in this way. Okay, you can collect the nipple on the way if it's not too early. Okay, otherwise just go above the nipple, to the nipple, above the nipple, and you can put your arm up and go over the top of the nipple up to the shoulder. This is all pec, so you want to be massaging that. If you feel any lumps in the pec that are scar tissue lumps, like I've got a little one just here, go into a circular motion, push it down into the chest and circular motion like this. And you can move along, move all the way around to that scar tissue that you can feel. You don't have to be there for long. You definitely don't initially feel that it melts away or anything like that. You just massage around it. You might feel it soften. That's usually the muscle that's holding on to it. Okay, once you've done above, you go below. So we go below the scar, and you can actually don't have to go just to the armpit. You can come back and sweep that way and come back and sweep. So we're actually going along the rib cage here, and this is to remove any sludge, okay, sludgy like lymphatic fluid that's just caught in the muscle, or caught in the muscle in between the muscle and the fascia that run along the ribs there. So you just do a few of those, and then we want to actually do the scar. So if you lift your arm up and rub along the scar, like so, do about 3 to 5 sweeps of that. Okay, and you'll feel, it's actually quite tender for me here under the armpit. You might be more tender here towards the sternum. That happened for me in the first little while. Anywhere where it's more tender, you want to sort of spend a little bit more time, again, going in a circular motion. If you feel lumps, zone in on the lumps and go in a circular motion and start to release the scar tissue. And you want to go in a circular motion incrementally back along the scar. And again, if you hit a lump, just focus on that, stay there for a while, and you want to do it all the way back to the sternum. If your sternum is sore, here in the middle, come up, circular motions up, come back down. You do that a few times, you basically, because the sternum has no scar tissue on it, but it's got fascia that's holding the scar tissue in, you can do that until it doesn't hurt anymore. And I would recommend that. Great, so make sure that you do a few strips, 3 to 5 strips in the area above here, below. If you come across any lumps, circular motion pushing down until you feel like either it's softened or you're over it. Okay, the same thing along the scar tissue. Push along the scar tissue. If there's a tender area, spend time in a circular motion in the area. If you go along the scar tissue and you feel any lumps, spend time pushing down and in a circular motion, massaging those lumps. Good, so I hope you found that information good for you. If you have any questions, feel free to direct message me, private message me, or just leave a comment on this video. It'll be up on my YouTube and it'll be up on Instagram. Awesome.